Have you been prescribed medication by your doctors, taken the prescription, gone to have it fulfilled in the pharmacy, gone home, opened up the medication, and you don't quite understand what to do with it or how it works? In this video, I will help you get the best use of your medicines. Welcome to today's show. I'm your pharmacist, and today I have with me a special guest. She's actually a pharmacist as well, and today we're gonna do some role playing as examples to help you use your medication better and show you what pharmacists can do. I'm sure you can relate to this in your pharmacies.
Yes, I do get a few conditions, you know, asthma, pain, skin, different conditions, and they leave the consultation feeling better, and they do understand their medicines more after the consultation.
Why don't we do something fun today?
I think it'll be a good idea. Yeah.
Let's do some role play.
Good.
Am I going to be the patient, or are you going to be the patient?
Patient, definitely the patient.
Okay, let's go. Okay.
All right.
Okay. Hello there. You wanted to see me regarding your medication?
Yes.
How can I help you?
Been prescribed a few medicines from the doctor. Okay. So there are 3 different things. Don't quite remember their names, but I brought one along with me.
Okay. Yeah,
all right.
Of course,
okay.
Of course.
So we could start with the first one.
Okay.
Is it all right if you just? I'm really not sure. I don't know. I definitely know it's meant to be this way.
Okay.
But I don't know if I'm taking it properly.
Have you ever used this before?
No.
Okay.
Is it okay if you show me?
Of course. It's my pleasure. I will show you how to do this. Okay. Firstly, do you know what this is for?
I think I feel a bit tight-chested.
Tight-chested.
Is that what it's for?
It's to help your breathing, to open up your lungs.
Okay.
As we say.
Okay. So does that work right away? Like once I take it, it opens it up?
This is actually, you say you were prescribed 3 inhalers.
Yes.
This is what they call the reliever.
Okay.
In the scheme of things. So it's the almost, instant reliever. It opens up so you can breathe again.
Okay.
You're going to have others. The others are probably, you're going to have one which is a long-term preventer, which does the healing as well as keep it that way. So you really shouldn't be using this too often. But let me show you how to do it firstly, and then I will tell you how often you should use this.
Okay.
Okay. As you said, you got it right. You opened it up.
Yes.
Yeah, but I'm not going to do that now. And then, how many puffs do they ask you to take? 1
or 2 whenever required.
1 or 2 when required. There we go. Keynote when required.
Yes.
And try not to use this, please, in general, no more than 3 times a week.
Okay. If
you find yourself using this more than 3 times a week, you're probably not doing something right with your with your other inhalers.
Yes. That is why I came to you, because I want to make sure I'm using it properly.
Yes, this is the reliever. So if you're feeling wheezy or tight-chested, then you use this to open up the airways so you can breathe again.
Okay.
This is my inhaler. Okay. Because obviously I don't want to, breathe on yours. This is my inhaler. I'm going to show it to you. Guys, watch this. You'll learn something. So firstly, breathe out as much as possible.
Okay, so...
Out, not in, out. Exactly, because what you're going to do is breathe this in.
Okay.
So
did I get that right?
You didn't need to do the dramatic interference of everything. Just breathe out.
Okay.
No. And then...
Okay.
Did you get that?
Yes, I do get that. That definitely.
Do you see how that is?
Yes.
Okay, so as I said to you, this is when required, as it says on your medication.
Okay. And that's the blue one.
That's the blue one. So you should have another
reliever,
brown
preventer,
one.
reliever.
No, this is a reliever.
Yes,
this is a reliever when required.
Yes.
No more than 3 times a week, please.
Okay.
Please. The other inhaler that you have, the brown one, you say.
Yes.
That you should use. Well, it's twice daily. They told you to do that.
2 puffs.
Every day you
Morning,
use that,
evening,
because that is a preventer. A preventer and a healer. If the lungs are weak, then that heals it, and then you continue using it to prevent it, getting to the stage of this. So, but obviously sometimes you might run up the stairs or do some exercise and feel a bit wheezy, then you use this again, 1 or 2 puffs, as it says on your prescription.
Yes.
And then you're good to go again.
One more question for you though. Now you've done this.
Sure.
Pain. I'm feeling a bit of pain in my joints.
Oh yeah. Okay.
And then I did mention that to the doctor.
Okay.
I said I didn't want any tablets or anything. So the doctor recommended some gel. I think it's Voltarol.
Voltarol. Yes.
Said I should rub it 3 times daily.
Okay.
So now I'm not quite getting. I'm not sure if that's working as it should do. Is there any additional pain relievers you could recommend for me? Okay,
firstly, I would ask you, how long have you been rubbing the Voltarol in?
Oh, that's a good question. I really don't use it 3 times a day, so
maybe. That's number 1.
Maybe.
Okay, that's number 1.
So I would say I probably use it once a day.
Once a day. And how long? When did they prescribe? 2 days ago, and once a day. Do I need to say any more, madam?
Shame on me.
Shame on you. But everybody does that, so use it as prescribed.
Okay.
3 times.
So what if that doesn't work?
Well, try it for a week, a week and a half. If you're still feeling...
A week? I can't bear that pain for a week.
Okay.
3 days.
Okay, fine. 3 days. You use that for 3 days as prescribed, not once a day, 3 times a day.
Yes, 3 times daily. Rub it in.
It will definitely get better, or it should get better.
Okay.
And if you need something to plus it on, because of what it is, Voltarol, the only option that I have available for you is paracetamol.
Oh, okay. Oh, those tablets are big.
Yes, they come in. These are the soluble tablets.
Oh, soluble. That would be easier.
They come in tablets, round tablets. They come in little caplets, as we call them, and they come in capsules, and they also come in these.
So this is paracetamol soluble.
Yes, yes, 500 milligrams.
Okay.
And you dissolve 2 into a little glass of water. You let it dissolve, and you just drink that. And please don't do that more than 4 times daily.
Okay, that's fine. Okay, that's fine. I'll rub that with my gel 3 times daily, paracetamol to top up. Okay. We'll see.
And what dose is paracetamol?
I don't remember.
Okay.
Just remind me.
No more than 4 times a day.
Okay.
No more than 4 times a day.
Okay.
You might only need once or twice a day.
1 or 2, 4 times a day. Okay, I remember that.
That's every 6 hours.
4 times a day. Paracetamol, yes.
Up to 4 times a day. Keynote, up to. If you don't need it, don't use it.
Okay, all right.
Okay.
That's good. Oh, brilliant. I feel way better now.
Any more questions?
No, that's it. You've answered all my questions for me.
Okay.
Yes.
Thank you, expert patient pharmacist.
Thank you.
So that was our little role play session there. Hope you found that educative. Now you know what pharmacists and pharmacies can do for you with your medication. If you're having problems with any medication, you don't know how to use it, or you don't feel it's working or anything, pop in to see the pharmacist. That is what we are here for. Also, if you do find it easier to bring your medicines in like I did, feel free to do that. That makes it easier for the pharmacist to describe them to you. Okay? As the pharmacist said, it's once a year, and you could always go in whenever. It doesn't need to be once a year. As a professional yourself now, as a professional, not role-playing anymore. Yes, as a pharmacist, yes. The little role-play session that we just did there, how do you feel about that? Do you feel it's helpful to patients? Yes, I do. I do get constant, where customers come in where they don't understand what is going on, and they do feel better after. For instance, there was an example of ibuprofen and warfarin. That's 2 things that shouldn't be mixed. So I explained a better option, and I explained the importance of not using ibuprofen with the warfarin. So it's things like that we do get day and day. Of course. Yes, it is a good idea. I always recommend customers to speak to their pharmacists. Yes, because what's the first thing on our principles? Make the patient's care your first concern. That is your care. And that is how I'm shooting off. Have a good week. See you next week, guys. Bye, everyone. Bye.